interventricular sulcus isn't really anatomically correct. It's going to go a little bit more diagonal. This one leads more down the midline. But it's really easy to identify the posterior and the anterior on this model. Obviously, this is the anterior. Obviously, that's the posterior. So if we open up our chambers here, we got the inside of the right ventricle. This is the tricuspid valve, or the right AV valve here. Tricuspid valve, right AV valve. Papillary muscles connecting them. Just find where the, these would be the chordae tendineae. Find where the chordae tendineae connect, so that'd be a papillary, that's a papillary, that's a papillary. All right, so this is the chamber of the right atria. This is the interventricular septum, or sorry, interatrial septum, excuse me. And then where that says 55 right there, that's the fossa ovalis.
Sorry.
Did everyone see that?
Got it.
Fossa ovalis right there. It's just a little white circle spot. All right. If we open up the atria and we look at the atrial muscle, this is going to be the pectinate muscle on the side here. Same thing over here. This will be the atrial muscle. This is the pectinate muscle over here. We go down in the ventricles. Everywhere you see muscle lining the ventricles, it's not connected to a chordae tendineae. That's going to all be trabeculae carnae. That's all trabeculae carnae, trabeculae carnae, trabeculae carnae. All right. This is the interventricular septum, right here, just this portion. Going into the left ventricle, this is the bicuspid valve, or the mitral valve, or the left AV valve. This is the left atria. Let's start here. So we go back to the right ventricle. This is the right semilunar valve, or the pulmonary valve. And as soon as it crosses this valve, as soon as it leads from the right ventricle into this next vessel, this whole thing here is going to be the pulmonary trunk. Okay? As soon as the pulmonary trunk splits, these are going to be the pulmonary arteries. So that's a pulmonary artery right there.
What are these two?
These are the vena cava. I can go into that actually. This is the superior vena cava here, and then this would be the inferior vena cava coming in down here. Let's see, other side. You can't really see. You can't see an aortic valve on this, so I wouldn't worry about that for the test. This whole thing is the aorta. This giant artery right here. There's three separate portions of the aorta. Where, if you're looking at this like it would be on a body, if you're pushing blood from the left ventricle up, the blood has to ascend during this part. So this is the ascending aorta. It travels around this little curve here, which is called the aortic arch. And then as soon as it travels around the aortic arch and starts to go down, descending aorta. It's not too hard. This little white spot here, this is indicating a tendon or ligamentum arteriosum. And if y'all need to know, yeah, I think you do. These right here connecting to the left atria, these are the pulmonary veins, okay? So pulmonary veins are right here. I think that's about it. Did I miss anything?
Are these the auricles?
Yeah, these kind of scrunched up tissue-looking things on either atria. These are the auricles. And all an auricle is, again, is just extra tissue so that the atria can expand when it fills with blood. That's all that the auricles are.
And this is the aorta valve.
Oh yeah, you can't see the aortic valve. Sorry. Yeah, if you want to look down in here, that's the aortic valve. And again, that would be the posterior interventricular sulcus, anterior ventricular sulcus. I think that about covers it.